Awesome. Well, let's get started. And some of you may have to jump off of the call before I finish up. I want to start and leave you with a thought in case you do have to jump off. That the compassion and professionalism of this team throughout the extended period of the coronavirus pandemic has just been tremendous. Caring for patients while ensuring the stability of the organization and serving as good stewards of the community's resources has been our priority since day one, and it's come through loud and clear with all of the great feedback we're receiving from the work you've been doing. So before I get started, I want to give you some housekeeping things about how Zoom works. You'll see somewhere on your screen a Q&A feature. So that's the way to ask a question. The Q&A feature is private, so whatever you type in there, our moderator, Jody Connican, our VP of Marketing, will see, and our panelists will see. And at the end, when I'm done, she'll outline those questions to the panelists. Joining me on the panel are all the members of the senior management team. So any question that comes up, we hope we'll be able to answer. If we don't get to all the questions, I promise you, we will reach out directly to the individual who asked that question with an answer. I also want to remind everybody about the great resource of mymarybird.com. There's a tremendous resource center that the human resources team has put up on our intranet site. It's loaded with great information and resources about things available to you as a team member. One last thing, the chat button on Zoom, if you don't know, chat is live. So if you put something in chat, everybody's going to see it. So use the Q&A feature to ask questions. And one last piece, we are recording this. So if you do have to sign off early or your team members that you work with weren't able to see it, just let them know when the email comes out that they can click a button and they'll be able to watch the entire recording. So I want to start kind of early on in the pandemic with an example that really struck me. And I want to thank the members of the senior management team for providing a lot of great context for my remarks today. So early on in March, because of the alertness of our medical staff and the professionalism of our physicians and operational leaders, our organization network-wide started to do social distancing and implement screening measures out of concern for our immunocompromised patients. We didn't know much about coronavirus in late February, but our team was on top of it trying to figure out what to do, and they made some great decisions. And that came through loud and clear one day when a veteran who was a patient of ours stopped one of our patient care team members and said, "Look, I just have to tell you that I feel safe here and that all of my fellow patients feel safe here." And this gentleman conveyed that he goes to a lot of other organizations for care associated with his clinical situation. And he said, "You guys are doing it better than anybody else, and I just appreciate it." And when his treatments wrapped up, he said his visits here couldn't have gone better, regardless of the circumstances. Now, that's a pretty high compliment given how disruptive the coronavirus has been to our normal operations. And I know that's just one example of the positive encounters that have occurred across the entire network. We have an amazing team that stayed focused on our patients, and they rose way above and beyond the call of duty during this crazy time. So I knew, and our management team and all of you knew, something was really wrong probably by the early part of March. But, planning in times of uncertainty is really difficult. It kind of reminds me of going to take some multiple choice tests back in college when I wasn't very prepared. But it wasn't multiple choice, it was essay. We're fortunate at our organization because we have a mission that guides us. That mission to improve survivorship and lessen the burden of cancer. When you don't know the answer, and sometimes when we don't know the question, that's what we talk to ourselves about and remind ourselves that why we're here is to improve survivorship and lessen the burden of cancer. That guided us to remain focused on the care that our patients needed. Those patients entrusted us, and to care for them, we had to do some important things. We had to keep our team members safe, we had to keep them safe, and we had to figure out how to run our operations if an outbreak occurred at one of our locations. We also had to consider and take actions to stabilize the organization's finances because we knew economic destruction was around the corner. So The operations teams in response, they started meeting daily early on in March, and they reorganized our operations across the enterprise very quickly. And a novel approach, and this was we were the first organization that I heard about making this decision, and it goes back to Jonas Fontenot and his team and radiation oncologists and imaging professionals. They created a response team. At the time, we called it the clean team because they didn't have the virus. That group of team members signed up and said they would go home and shelter in place. And the purpose of that was if we had an infection localization in one of our treatment centers, that response team would be available to go and continue care for our patients. Shortly after our team put that in place, we started to hear of other cancer centers and other healthcare organizations doing the same thing. I'm super pleased to say that team, I think, came back to work yesterday. Huge thanks to all of them who stepped away from what they love, taking care of patients. They did some great work from home, helping their team members by checking charts and doing a lot of the administrative clinical work that takes place. But we're so happy you're all back and working again, taking care of patients. The details and the speed with which our teams responded during this time was just a huge and powerful symbol and a confidence builder for our patients. So back on finances, we anticipated that coronavirus would cause some substantial disruptions to our operational finances. The disruption that COVID caused has been unparalleled in modern history in the economy. I heard someone say the other day, and I've been struggling like you guys all trying to wrap my arms around this. One of my friends said, this is the first time in history that we've quarantined healthy people. And I don't know why. For some reason, that really set in for me. I don't know if that's a fact or not, but that statement resonated with me, and it reminded me that we are all in this together. And I hope each of you have found ways to cope and manage the difficulty and the stresses that this virus has brought on in our lives. Please remember again that we have a great employee assistance program, and you can find links and resources to it on our intranet page or by calling Human Resources. So back to finances. So in early March, when we started planning, we anticipated that Mary Bird might experience a significant downturn in our patient care revenues. I anticipated that, for example, the number of patients under beam, under radiation, could drop by as much as 50% in the coming months. Fortunately, that's not materialized. However, we have experienced significant declines in our clinic visit volumes. Our new patient consultations are running right now. They appear to be running about a third to a half of their normal levels. Our imaging services were disrupted. And also, we had an 18% decline in our endowment investment and our other investments that we have set aside to protect our future. Some of those investments have come back, but at the depth of March, 18% of our investments had evaporated with the economy. Also our fundraising events. Our development team is just a spectacular group of people that extend our mission by raising community dollars to put back into work in the fight against cancer. In mid-March, we were one of the first organizations to cancel an event that had, I think, 240 people were planning to attend. We were all so jazzed about spreading the mission and the great work our team does. We had to cancel that event. And we've canceled or postponed, together with our third-party sponsors that put on events for us, all of our events through the rest of the year. That's a material amount of revenue that comes in from the community associated with those events that we won't see back until hopefully 2021. So knowing that all this uncertainty was ahead, we had to start making some difficult decisions, including staffing adjustments. We were also very keenly aware of events going on at the legislative level, at the national level, and we were able, after we made some of these very difficult decisions, to apply for and receive relief from some of the great federal legislative programs that resulted during the early days of the coronavirus. We made some really difficult decisions, and I want each of you to know, across our network, whether you worked at home, you worked at one of the treatment facilities, you experienced reduced hours, You volunteered to work outside of your job scope to help screen patients, or you accepted that your work would be offline for a while and experienced being furloughed. Each and every one of you, you're healthcare heroes. Because without you, it wouldn't have been possible to continue our mission during this crisis. So I want to say a huge thanks to everybody across the organization and across the hundreds of jobs and scopes of jobs that our team members do. So the countermeasures we applied for, they did help stabilize our financial outlook. And as a result, we began a couple weeks ago restarting work in many of our impacted areas, including our outreach Prevention on the Go programs. And I mentioned Prevention on the Go because I want to give you another example of how during this disruptive time, our mission has made such a huge difference in the lives of individuals. So on Tuesday, April 28th, which in April 28th seems like a lifetime ago, it was in the midst of the shutdown with no end in sight, our Prevention on the Go hotline received a call from a 32-year-old female. She was concerned about a lump in her breast. And based on the description she left on the hotline, our team members knew that she shouldn't and couldn't wait for days, if not weeks, to have her situation looked into. So within 2 days, they reached the patient. They coordinated with our nurse practitioner and our partners at Women's Hospital who support our breast screening program and got her in for a workup. And the long story short is by May 7th, she'd been diagnosed and had been in a surgeon's office with a plan of care going forward. That might not have happened and would not have happened without our Prevention on the Go and our commitment to our mission and to all the donors and grantors that fund our Prevention on the Go program. This young lady has a very complicated cancer. She's got a long journey ahead of her, but she's got a great team, a great support network there for her. And I want to give a shout out to Prevention on the Go team, as well as our research team and all of our teams that have stepped up during this very difficult time to do whatever was necessary to take care of patients. You know, I mentioned a minute ago about the contribution so many made in the screening programs. We've had team members from basically every part of our organization serve as screeners. And you know what's really interesting to watch, and it's so wonderful, the empathy that comes through. So many of our patients are having to come, all of our patients are having to come alone right now. And when they enter the facility and their loved ones left outside or they were dropped off by a loved one, our team members become their family more than ever. And we've heard that loud and clear from so many patients across the network about how important the care and concern our team members have shown. So we are all truly patient care givers. And this COVID-19 crisis made that certainly more apparent than ever before. And in appreciation of all of the work the team's done, our local businesses and community citizens have brought donated gift cards, homemade masks. They've opened up special shopping hours for our team members. So please know that the work you're doing is appreciated not only by all of us here, our board members, the community, and the patients. It's making a difference every day. Now also our development team, they started, this is another great example of how supportive our greater communities are. We started a $100,000 fundraising goal to raise dollars to help patients impacted by COVID-19. We had two donor families step up and say they've set up a matching gift. And so far we've raised over $80,000 towards that $100,000 goal. And I know within the next couple of weeks, they will reach that goal and exceed it. We also did our first virtual fundraising event. It was an event in Hammond. It was a Go Yoga event where folks sign up and make donations to do a workout, and that their donations go back and support the fight against cancer in our Hammond location. You know, in Covington, I just saw this story the other day, and it kind of blew my mind that 1,600 COVID care packages were passed out to patients. And that was a partnership between the communications team designing a custom bag and the team on the ground in Covington putting together and handing out 1,600 bags, which included hygiene items such as toilet paper, toothpaste, cleaning wipes, and deodorant. They just really wanted to make sure that patients had those elements because they didn't need to go to and be exposed by going to the grocery store to get those items. So that was just a really wonderful measure that was put in place. And then in Gonzales and really across the network, we've leveraged technology. Our physicians are doing remote telephone visits to virtually provide services, as well as our social workers and patient navigators and nutritionists, all reaching into patients' homes through technology to support them during this disconnected time. You know, there's still a lot of medical services that are offline, and when they will return, but they're going to return in a limited capacity. We do anticipate there will be many months before the healthcare system and patients adjust to the COVID-19 realities. But we're confident that these countermeasures we put in place and will continue to put in place have worked, and that we're going to be able to stay focused on our mission. Governor Edwards just last week, his order to lift the stay-at-home order went into effect. That was put in place because hospitalizations are just decreasing. Our per capita caseload in Louisiana has plateaued. Testing is now more available than ever, as well as contact tracing, which is ramping up. And as a consequence, now we're able to see restaurants and gyms and churches coming back at a limited capacity. And we hope that that process continues. But it's still important for our immunocompromised individuals and people who are at risk to stay home and to be safe. And because of that, and because we care for immunocompromised patients and patients at risk, it's really important for us to remain diligent across our network to protect not only our patients, but our team members. You know, much of the healthcare system that's important to the cancer care continuum, it's just now turning back on. This week, hospitals across the state are restarting screening mammography programs, and we anticipate in June that programs that do things like colonoscopies and bronchoscopies, that they'll start to get back up and running. But they're not going to get back up and running at the capacity that they were pre-COVID-19. We're also super excited that our Prevention on the Go community programs are going to start back up in June, not only in the community, but in the workplace. And that our clinical research team is also starting back towards normal operations. During the pandemic, clinical research programs across the country restricted accruals to new patients, to only patients where that clinical trial was the medical option that was best for them. So I know Cindy Knox and her entire clinical research team are excited about getting back to work and advancing clinical research. So as all these screening programs turn back on, and they're not going to turn back on full steam for a while. We expect to see a continued lag in the number of patients that are accessing our organization for care. But we're doing everything we can to get the cancer care continuum turned back on for individuals who need our care. You know, all these are just super positive steps in propelling cancer care forward and supporting our organization. And I promise we're very well poised to weather the situation. Last year, I mentioned our development team a couple times. Last year, they had a record year. The communities across our network provided unprecedented level of support for the organization. So I think we're well positioned to continue our investment in focusing our needs on all of those services that cancer patients need as a consequence of the great community support we receive. A huge thank you to all the frontline team members who cared for patients. And that includes everybody who screened a patient, stood outside in a mask and asked those difficult questions and ascertained those difficult answers and figured out the right thing to do to protect a patient and our team members. We're not out of the woods yet, but we have a great plan, and we've got great team members, great community support. And with the vital activities, we're impacted and ready to stand the test of time, as we always are. So I want to wrap up here, but I want to remind you a couple of important things. Please know that the steps will progress while focusing on safety and health of those we serve, our patients and our team members. Individualized areas will create appropriate work plans and schedules, cleaning protocols, and PPE as needed. We're able to work with our employees and we'll keep our concerns and obstacles in returning to work in mind. Please encourage any ideas you have or any ideas your team members have to keep things safe and clean. Please talk to your supervisors and managers about those things. We'll continue to flex staff assignments as needed to ensure productivity across the organization. We're going to continue to match our workforce based on the demand of our patients and our services across our network. We have to remember to remain diligent and good stewards of the organization's resources during this time as things ramp back up. And we absolutely must remain vigilant and safe. The safety primary guide, which is to follow and adhere to the CDC guidelines, washing our hands, practicing social distancing, wearing our face mask when we're in our common areas or at risk with others. It's critical that if you feel sick, you should not come to work. Call your supervisor, talk to them, let them know what's going on. We need to make sure we protect all of our team members and all of our patients during this time. I also want to remind you about the Ask Anything email. It's askanything@marybird.com. And it doesn't have to be asked. It can be a recommendation. It could be anything that's on your mind. If there's something on your mind that makes us a better organization, makes you feel safer, makes our patients feel safer, extends our mission, fire off an email to askanything@marybird.com. And that email will get to the right place. And we'll get back to you with an answer or more questions, and that's how we get better, is by all supporting each other. Remember, we have been in this together, we are in this together, and we will remain in it together for our mission to improve survivorship and lessen the burden of cancer. A huge thanks to all of you for everything you've done, and to all your team members, and to your family members who've supported you working during this time. I know how hard it is to leave your home, leave your families, and go to work in the midst of one of the most unprecedented crises in modern history. So thank you for everything you've done to extend Mary Bird's mission. So that's it for me. I'm going to turn it back to Jody, and she's going to see if we have some questions come in, and then she'll direct them to the various panelists and see what happens.
Okay, if anybody does happen to have any questions, you can click on Q&A. It's at the bottom of your Zoom screen, and we can answer those. At the moment, it looks like we don't have any questions on the field, but we'll give them a couple of minutes to think about it. As Todd said, we will definitely, if you send us something, we can always respond back to you individually if you need it, or you can also use askanything@marybird.com, and we can respond back to any questions to make sure everyone's informed and up to date.
Super. While we're waiting for a couple of questions, I'll ask the management team if there's anything that I missed or that you want to echo, or feel free to chime in.
Hey, Todd, it's Jonas here. I just want to chime in and echo your sentiments related to teamwork. I mean, our teams in various groups have been extended to try to meet different challenges that have depended upon each location, each department, and strictly speaking, you know, when we didn't build out our teams and our departments to support these kinds of things. So we've really been highly dependent upon the support and teamwork from other departments and groups to meet those challenges. And I've been pleased at every turn by how responsive and how willing everyone has been to pitch in to meet those challenges along the way. So I've been quite impressed across the board by our entire team.
Awesome.
Oh, well, Todd, you did such a great job. Nobody has any questions.
Excellent. Excellent. Well, if you do have questions, please put them on Ask Anything at marybird.com, and we'll get back to you. And certainly, if you have questions for your senior management team leader or your manager, just reach out directly to them. We pride ourselves on open communications. If there's something you want to know and we know the answer or can find the answer, we'll find it and pass it on to you and then to the rest of the group. So thanks everybody for their time.
Todd, if you have a quick second, we do have a question come in. We have a couple. One was, how long do we anticipate screenings being at the front entrance?
Hey, that's a great question. I asked that question of Jonas about twice a week, and it's particularly, I ask it because of the dislocation I see of the family members and the caregivers from the patients, the dependence and co-support that patients receive from their family caregivers is just so vital to their journey and to the support they need. So we're anxious to be able to turn that back on and get them closer and closer. The answer is I don't know. If it's going to be a month, 2 months, or 3 months, I think the answer is it's going to be for the foreseeable future, and that we're going to continue to be required to restrict visitors until we have more visibility and how the economy being turned back on is affecting virus numbers. It was important for us to be on the front end of locking things down. We were one of the first organizations to be a strict no visitor policy, to implement universal masking. So we were on the front end of all those things. We're going to likely be on the back end of opening things up and exposing our immunocompromised patients and our care team members who provide care to them to the uncertainty until we have some better visibility into how the economy opening up is going to affect virus numbers. Jonas, you want to add anything to that?
Yeah, I'd add a couple of things to that. The first is I think our team, our organization has a great story to tell in being able to persevere through the current crisis. You know, we didn't shut down as a healthcare organization, and we weren't materially disrupted to the extent that most of our patients weren't showing up anymore. In fact, we remained steady and busy throughout the entire crisis. And so I think by virtue of that then, and because of the sensitivity of our patients to this infection, it was incumbent upon us to really take some extraordinary precautions to ensure that they were entering a safe environment along with our team members each and every day. And so the fact that we avoided the types of outbreaks that you may have read about in the news at places where there are vulnerable populations, nursing homes, assisted care facilities, et cetera, I think provides a testament to our efforts to ensure that the environment is safe and free from harm. So I think by that logic, we don't really want to change what's working as long as the current environment is still in place. So I agree with Todd that I envision screenings continuing for the foreseeable future. I would also add that I do see a pathway for visitors to return at some point, probably sooner than the point that we discontinue screening. So there may be a circumstance where we are allowing visitors and family members in on a limited basis at the same time that we're doing screening. So we are reassessing that all the time and making changes when indicated based on circumstances on the ground.
Thanks.
We have another question, a couple more questions on the table. One related to some of our hospital partners are providing antibody tests to staff, and we were wondering, there's a question about if Mary Bird was partnering with any of those or has any feedback on different testing that might be available to staff members specifically.
Yeah, the testing has been a guidepost of the operations team that's been meeting. Jonas and Casey Chasson have been meeting with physician teams, so I'm going to defer that answer to them and their clinical knowledge of and feedback from physicians about serology testing.
Yeah, sure. So a couple of comments to make on that. First, I think it's important to distinguish between the two different buckets, general categories of tests. The first type of tests are the ones that you probably heard the most about in the news. That's a test using saliva or using a nasal swab to determine if you have the virus presently. Okay, that's the first type of test that we've seen a lot broader availability of develop over the last several weeks, to the extent that there are a number of pathways now that somebody who has been exposed or who is feeling sick can utilize to be tested. And we keep a catalog of those testing resources available to us. Corinne Smith and her team helps to manage that process, to the extent that in each marketplace, if you have a circumstance where you're concerned that you may have been exposed, or that you are developing symptoms or have symptoms that are concerning, contact your manager, and there are pathways in every one of our locations to get you a test to see if you have the virus. And that process will continue to be in place, and I suspect continue to expand. The second type of test is called the serology test. That's a blood extraction that principally tests to see if you have been exposed to the virus at some point previously. Doesn't mean you have the virus now. It just means that you have the antibodies that developed once you became infected with the virus. And I think on the question of the antibody tests, the serology tests, the information and the methods by which, the ways in which that information can be used are still changing. In many cases, some of the tests being used for antibodies are still unreliable. And what I mean by that is that there can be a high percentage of negative tests when the person really had the antibodies, or vice versa. And it's not clear how we use that information. We don't know yet whether the presence of antibodies provides any meaningful immunity to becoming infected again. We think that there may be some relationship there, but I think there really is a lot more to be understood there that we don't know now. So yes, there are avenues in the community to get tested for antibodies. The key question is, one, the quality of the test, and number two, what do you do with that information? Since we don't know really what having antibodies means in terms of immunity. Hope that answers that question.
Thank you. I think so. Although we feel free to follow up with us if you need more information. We do have another question related to the need for masks and maskings. And the question relates to, if anyone deals with a patient in any capacity, should they have a mask on, and what's kind of frequency we should be using those in the office setting as well as in the clinical settings.
Hey, Casey, you want to cover that one? Because I'm pretty sure we're still on universal masking.
Yeah, absolutely. That's correct, Todd. We are universally masking throughout the clinic. So if you're in a clinic setting and you're engaging a patient, you should at all times have a mask on. In common areas, the same thing. If you're around other team members and you're in a general area, the same thing applies. So the answer to the question really is, if you're not like in your office the way we kind of all are right now on this Zoom call, and you're interacting and you're in a public area, or you're specifically with patients, you should at all times have a mask on. And even to enter a building, one of our buildings, when you come through the screening, you should don a mask at that point of entry coming into the building.
Yeah, thanks very much. And I would encourage everybody, you've heard comments about mask police and things like that, but we are in a different environment. It's different here than in a retail outlet. Yesterday, I came in to the front entrance of the Essen Lane building, and there was a gentleman who was clearly working with a vendor, looked like a vendor that was supporting our facilities, maybe a HVAC vendor who was here for some work. He didn't have a mask on. I went up to the front desk and asked for a mask, and Jessica, who was on duty, very politely came up to him and said hi, introduced herself, told her what her role was, and handed him a mask and said, when you're in this facility, you need to wear this. So don't be shy about politely reminding visitors about the policy, and certainly working with all your team members and encouraging encouraging them to do the same. It's incumbent upon us that we keep our patients safe and that we keep all of our care team members safe. Because the last thing we want to do is send that response team back home. And I'm certain from the descriptions that Jonas passed on to me during those 7 or 8 weeks while those team members were at home, I don't think they want to go back home either. So let's keep our masks on.
I have a lovely question from one of our employees asking if there's anything that our staff members in clinical areas or our patients might need at this time that other areas of the business might be able to support them in some way.
That's a great question. And we've seen a lot of our team members have connected us to churches and programs that have made our cloth masks for us. So I don't know if our teams across the network still need more cloth masks. If they do, that's certainly an avenue to continue to recharge the production of those. The little mental breaks that we get, notes from team members to each other, thanking them for their work and their partnership and supporting each other is always a great way to go. But let's give that some thought and get that back out to the teams. If anybody else on the panel has some ideas, certainly toss them out there.
Well, I think that's a good point, Todd. Any kind of outreach to say thank you, I think goes a long ways, especially now that we're kind of opening back up and things are starting to seem kind of normal, but they're not. And so, going through this process has probably been stressful on a lot of our team, and we've all handled it well. We've all done a great job, I think, of showing up every day and being careful whenever we leave here. And I think any kind of just small thank you or, hey, we think you did a great job. Any of those kinds of little small tokens go a long way.
Absolutely. We'll give that great question some more thought and keep that sentiment going. That's what makes our team so strong. And when I was thinking about what to tell you guys today, the line that I underlined in my notes about making sure that all of you know your healthcare heroes is really the most important to me, because every single person here, it doesn't matter what your role is. If you routinely touch patients, we are all interconnected. Without the work of every team member across the organization, there is no Mary Bird mission. There is no ability to care for a patient. So just know that you're all part of the heroic team that made our mission work at its best during the last many weeks. And hopefully for the next few weeks, we'll continue that and we'll start to see a return to some new normal going forward.
I have another question that circles back on screening a little bit related to how we staff the front area, and if there is currently a plan in place as some of those team members who have volunteered from other areas, as you mentioned, go back to their full-time jobs.
We're actually working on that now. We have a team call 3 times a week, and our call yesterday spent several minutes on that topic and trying to figure out exactly what the requirements are and how best to use technology and personnel to screen patients and keep that level of safety that Jonas articulated a few minutes ago up, but also do it in a way that's as efficient as possible and as mindful as possible about the resources that it's taking to do that work. So I think within the next week or so, we'll have a plan in place that will organize a thought process around how we screen for the foreseeable future. I think it'll look different than what we've been doing in the past several weeks, but the outcome has to be very, very similar.
Okay, and at the moment, this is the final question. If anybody has any other questions, feel free to send them in and we'll see if we can address them either live or as a follow-up. But we did get a question related to if we've had any COVID positive patients and how we kind of manage that, and if we've had any COVID positive employees and how we've managed that.
Yeah, that's a super question. I'm going to tend that one back to Jonas, because those guys and Casey, because they spent a lot of time on a few of those instances.
Yeah, the short answer is yes to both of those questions. How did we handle it? Well, in the case of the patients who had tested positive with their specific diagnosis, and it was in each scenario, there was a case-by-case discussion with the patient, with the treatment team, with the treating physician to determine what the appropriate steps would be. And in all of the scenarios, all the situations that involved a positive patient that I'm aware of, it was possible from that patient's diagnosis to put them on a break and allow them enough time to recover until they were recovered and well enough to return to treatment and return to our clinics. In the case of team members, we did have a couple of team members test positive for COVID-19 along the way, or were presumed positive along the way. And again, pleased to let you guys know that we were able to identify them quickly. Fortunately, both were really good about following the instructions that we have been putting out since the beginning of the outbreak, and encouraging all of us to self-report if we start to feel any symptoms. And we were able to self-isolate them quickly. We instituted some precautionary measures with team members that they interacted with, and were able to avoid any transmission of COVID-19 in the workplace.
Okay, guys, I think that are all of our questions from the group at the moment. If you have any questions in the future, or you think of something after this is over, feel free to email us, and we can always follow up with an additional response. But I think that is it. So Todd, if you want to go ahead and close this out, I think we've answered the questions on the board.
Great. Thanks, Jody. Thanks to all the panelists for joining, and thanks to all of you. Please encourage your team members that weren't able to watch to check out the recording. Also remember the great resources that are available on our intranet page and the COVID resource page. And then also any questions that come up after, please send them to askanything@marybird.com, and we'll look forward to seeing everybody soon. Thanks for the great work. Have a great day and a great rest of the week, and we'll see you soon. Thanks so much.